November is National Diabetes Month. According to the CDC, about 37.3 million people have diabetes. Having diabetes means your body can't regulate blood sugar because of inadequate insulin production from the pancreas. The condition can lead to several health issues, especially when patients struggle with management. Now, today we welcome Dr. Jacob Clendenon from the Mayo Clinic in Florida Transplant Center. Thank you so much for being with us this morning.
Good morning. Thank you for having me.
We're going to talk about the impact of diabetes and perhaps a surprising cure for it. But first of all, can you describe for us, maybe a little better than I did, what diabetes is in relation to the pancreas, how the two work together?
So you had it absolutely correct. So diabetes is a disorder of how our body produces energy from food. The food that we eat is turned into a simple sugar known as glucose. Glucose is the main fuel that our body needs to function. Insulin, which is produced by the pancreas, is very important in getting glucose from our bloodstream into the cells that need it. With diabetes, either the pancreas doesn't make enough insulin, which is known as type 1 diabetes, or there is a resistance to the insulin being made, which is known as type 2 diabetes.
And how does it affect a patient's quality of life, especially if they have difficulty managing it?
Diabetes can have a big impact on our health and quality of life. The high blood sugar levels can affect the blood vessels, both large and small, in the body. This can in turn affect other organ systems such as the heart, the kidneys, and even the brain. Patients with diabetes have a much higher risk for things like heart attack, stroke, high blood pressure, kidney disease, nerve damage, skin infections, and a number of other issues.
Well, let's talk for a minute about treatment. Diabetes is a chronic condition, as you mentioned. Some patients have to have medication while others don't. Has there been any innovation in this field on ways to treat and cure diabetes? It's been around for a long time.
Right. There really has been a number of innovations that have happened over the past years. For patients with type 2 diabetes, there are medications that can be taken by mouth. And just changing the diet can sometimes cure type 2 diabetes. For patients that still require insulin, there are new technologies that have become available that make it easier to manage the diabetes. There are monitors that actually just look like a little patch that goes on the skin. They can continuously monitor the blood sugars and send that information to your phone, so you don't have to be pricking your finger for blood multiple times a day. There are insulin pumps, which can give insulin sort of on a continuous basis, which helps even out the blood sugar levels, so you don't get really high and low swings in the blood sugar that you get with just traditional insulin injections. I will say, though, the only cure for diabetes is something called a pancreas transplant.
Right. We just have a few seconds left, but this is very exciting. Can you tell us a little bit about how a transplant would work?
Sure. A pancreas transplant consists of taking a pancreas from a deceased donor and implanting that into the patient with diabetes. It doesn't require removing the old pancreas. The new pancreas makes insulin in real time, can respond to changes in the blood sugar levels, which avoids real highs and lows that you can see with just giving insulin.
Dr. Clendenon, thank you. Thank you so much. We appreciate your insight. And if you at home are interested in learning more about this, you can head to Mayo Clinic's website for more information.